My mother left when I was 12. My dad was alcoholic. It wasn't good.
I had 3 suicide attempts within 2 days because I felt so terrible.
I was 39 years old. I had recently been through a divorce. Going through that process led me into methamphetamine addiction.
I was scared. I had a really big, pretty smile that nobody knew, like just what was going on inside Amy.
Windows wide, the curtains fly to catch the evening breeze. Without you here to keep me warm, believe it right.
Tell me a little about your experience. How do you like it? How long have you been doing it?
I've been here for 14 months, and we used to be bitter about being here, and now I think this is one of the best journeys I've ever been on.
Just being out here, I found my purpose. I actually know what I want when I leave this place.
When the sky said the winter time was coming on, and you cried to see a shadow, babe, was growing long.
We keep them in the raised beds too because the rabbits like eat all our food.
Yeah, they do.
We gotta hide it from them.
We have to hide the rabbit. We have owls stationed out in our little plastic owls in our garden to keep the rabbits away and the other birds.
It definitely gives us purpose. I mean, much better than just sitting back there and doing nothing. So we're very grateful for the opportunity.
If only I could tell you all about the dreams I keep, or about the dreams I keep. I wake up every morning and
We're going to take a look at the opioid crisis. How did it get started? How did prescription pain pills lead to today's heroin and fentanyl epidemic? In order to understand that, we first got to understand addiction. For a long time, addiction has been looked at as a moral failure, and it is absolutely not a moral failure. It is a disorder of the brain. Addiction has been known to be a disorder of the brain since the late 1700s. The first doctor in the United States that I could find that explained it that way was Dr. Benjamin Rush in the late 1700s. So we know that it's a disorder of the brain. What are the risk factors? What leads people to addiction? And what's the difference between dependence and addiction? Because these two terms are often intertwined and misunderstood. So let's start off with addiction. Addiction is continued use of a substance despite consequences. How I always explain it is this. If you get a DUI, does that mean you have an alcohol use disorder? Absolutely not. I'm not condoning drinking and driving, but a single DUI standalone does not mean you have alcohol use disorder. What about a second DUI? Absolutely. Now you have to start looking at alcohol use disorder. Why? Addiction is continued use despite consequences. And when you got a DUI, you spent 48 hours in jail in every state in the United States. It cost you money for an attorney. And a lot of times we put your mugshot in the newspaper to shame you. There were consequences. If you continue to drink in the face of consequences, that is addiction.
Have you ever known me to be nervous? I'm Lieutenant Chris Cook at Bedford County Jail. I'm the program director here, and I facilitate a program called MRT. It's Moral Recognition Therapy. It's a cognitive-based 12-step program. When they get to jail, they're classified and they go into a pod. So every person that's in that pod is in our program. They're all going through a similar experience, and they all bring to that group whatever, their own unique parts. And I think having that shared experience forms a bond with them when they get out.
Was it somebody's grapefruit?
There are a lot of successful programs out there, and there's no way that I'm going to be able to cover all of them. I can just use examples of where I work. First program I would talk about was the jail program in Bedford County. It's in Shelbyville, Tennessee. They take treatment behind bars to women who are incarcerated, almost all of them secondary to their substance use disorder. And they do things like teach them how to garden, to put fruits and vegetables and how to grow that, and the importance of nutrition and a healthy diet. At the same time, all of these women live on the same pod within the jail, and they're working on recovery all day long as part of their program from a therapy standpoint.
The herbs that we grow, they put in all of our food, tomatoes, squash, zucchini, it's really enhanced it too. So it's made it a lot better. I feel if you get up every day and come out here when it's just an option, that you're gonna go to work. You're gonna be successful on the outside. So
I think when you start looking at treatment in jails and prisons, then you'll start looking at ways that we are really going to come out on top of this in the end, although too many people have died already.
We come up with a plan. I sent Lieutenant Cook to some training, and it took off from there. So in my perspective, almost all of our inmates that come in at some point in time are struggling with addiction, whether it be stealing stuff for their habit and stuff, or they just get caught up and get caught with some drugs. Our philosophy was just lock the bad guy up and throw away the key. Unfortunately, that has not gotten us anywhere. We need to try a different approach on ending addiction, and it starts with everybody.
I think it's just amazing how far along and progressive the drugs have been. It's just so much more potent than what it used to be. And now meth is the big thing. And every time I think we've reached the peak, I find out that's not so. Something else comes out. Now it's fentanyl. Take a chance here. You'll either get high or you'll die, one or the other.
It doesn't end when you leave, it actually just starts.
I've been an addict probably since my early, maybe 15. And it started with alcohol, and then it led into marijuana, and then pain pills, any kind of pain pills. That was my DOC. That was a really scary place for me. I've lost everything that I've ever loved. I was in love with being an addict for a long time.
Addiction a lot of times is confused with the word dependence. What does dependence mean? Dependence means when I stop doing something, taking whatever chemical, I go through what's called a predictable physiologic withdrawal syndrome. We understand that in the world we work in as being dope sick. The hallmark of addiction is the phenomena of cravings, and everybody understands cravings. These are the same cravings we have for food when we're hungry and water when we're thirsty. The problem with addiction is that the cravings for the drug of choice that someone has who is addicted are 10 times stronger than someone's cravings are for food when they're hungry and water when they're thirsty.
You know, I didn't realize that I depended on being high all the time to just be comfortable in my own skin. And I was just spinning around, squirreling in circles, going nowhere fast. And when I got arrested, I was bitter. And this is the last place in the world I wanted to be.
The thing that leads to continued use of a drug after a period of abstinence is cravings. And if they can come on in 33 milliseconds, which is such a short time that you're not even conscious of it, how do you defend yourself against that? And that gets into some of the problems with treatment. It takes a long time to give people the tools that they need to be able to keep themselves out of a situation where they're liable to develop cravings, or if they do develop cravings, the tools they need to handle those cravings without sustained use. Can you tell me a little bit about growing up, what it was like growing up, and then kind of where substances fit into that as you were growing up?
For me, I grew up in Bell Buckle, and I was adopted. My parents and I are like a really big distance in age, so I felt alone sometimes, even though I had everything that I ever wanted. I was an only child. So I started looking to fit in. I was molested when I was 4. And that opened up a whole new door for evil stuff, really open and really negative things that I never should have even seen. And after that, by the time I made it to high school, I was pregnant for the first time at 13. I got pregnant again, and I had my oldest daughter, and that's when I found pain pills.
When looking at addiction, we've got to understand what it looks like. What are the risk factors? When I talk about addiction, I teach it as a slot machine. When the 3 sevens come down on the pay line, that's when the money comes out the bottom. Right? The first 7 is genetics. What is somebody's family history of addiction? Do you have a mom, dad, brother, or sister that has suffered with addiction in the past? If you do, your risk of addiction is elevated. The second 7 is trauma, physical, sexual, emotional abuse. They're called adverse childhood experiences. If you have this in your background, your risk of addiction is elevated. The third 7 is a social opportunity. It just simply means what's widely available and socially acceptable.
I didn't have boundaries, and I didn't know what codependency was. Like, I went with the wrong people and didn't know how to tell them no. Like, I thought it's what I wanted. I thought because it's what they wanted, so I was doing it too.
How in the world did pain pills become widely available and socially acceptable? In the early 1990s, pain societies began to say that we're undertreating pain and that we're too scared of opioid pain medication, and that these drugs weren't near as addictive as we thought they were, particularly if we use one that's long-acting. And there was a little company on the East Coast called Purdue Pharma that happened to have one of these long-acting drugs. They're called OxyContin. And OxyContin supposedly, because of its long half-life, had less potential for addiction. So the pharmaceutical industry promoted OxyContin as having a less than 1% chance of addiction, which was not true. And so you take a highly addictive drug and unleash it on a genetically predisposed and traumatized population, and you wind up where we are today. Today's heroin and fentanyl epidemic has its roots in the pain pill epidemic that got started in the early 1990s.
The first pain pills I ever got, I got them from a doctor. In 2006, I believe it was easy. You could get pain pills pretty much anywhere. All you had to do was start asking around and have some money. If you couldn't get them from a person, you could get them from any doctors, anywhere. And then whenever they started regulating medicines so strongly, that's when fentanyl came in.
How in the world did we go from pain pills to today's heroin and fentanyl epidemic? Well, if we look back and you see somebody starts taking pain pills, and it could be from a legitimate prescription, and then they start to develop tolerance, and they need more and more for less and less effect, and they can't stop taking it or they get sick. And then what we did in the United States is we said, oh, hang on a second. We're misprescribing pain medication. We have a bunch of pill mills around that are basically selling prescriptions. Let's shut down those pill mills and let's teach our providers, our prescribers, our doctors, our nurse practitioners, our physician's assistants, how to more properly prescribe these pain medications, which we need, which is all well and good. But what do you do with the people who are already addicted? And what do you do with people who are getting started now through proper prescriptions that go on to develop an opioid addiction? Because traditionally we have not had the resources to help those people from a treatment standpoint. So when you do that and you put the prescribing guidelines in place and you start looking at prescription monitoring data banks, which is what doctors and nurse practitioners and physician's assistants query before they write a prescription so that you don't have people going to multiple doctors. When you do all that and you limit the number of pain pills that are out there and limit the number of pain pills that are available for diversion, what do people do when that supply draws up? They don't just quit using, because remember, they get sick and their cravings are higher than our cravings are for food when we're hungry and water when they're thirsty. So they wind up going to street. And people who would have never used heroin before suddenly will use heroin because they can't be sick and their cravings are so bad.
Since the pills and everything got harder to get, I started substituting with the street drugs, fentanyl, methamphetamine, anything like that, pressed narcotics.
So now you have people who got started on pain medication. When that supply dried up, it's replaced in the market by cheap heroin. And I think most of us saw heroin coming on. I certainly did. What I didn't see coming on was fentanyl. And back 7, 8 years ago, we started seeing fentanyl on the streets in the United States. And what fentanyl is it is a synthetic opioid. It is basically taking the opioid that comes out of a natural poppy plant, altering it chemically by man to make it stronger and longer acting. And it's much more powerful.
I didn't know I could quit. I kind of expected to just die an addict. I was just going to work really hard, stow away money to make sure I could manage my addiction and still do what I had to do, responsibility-wise. Well, now I know that it is a disease, like it's recognized. People accept it. And I feel like without the proper guidance, we die from it.
Possibly the scariest part about the fentanyl epidemic is this. Today, you don't have to have an addiction. You don't have to have developed dependence. You can just use one pill and die. And I'll give you an example. Kids have parties. They're at the experimenting age, particularly late in teenage years. You go to a party, and back in my day, people would bring marijuana and alcohol, but after I grew up, it turned into pills. Valium, Xanax, Adderall, pain pills. And you get somebody who brings pills to a party, and you happen to pull one of those pills out of a glass jar or whatever, a bowl that they're being passed around in, and you get a hold of what you think looks like an oxycodone, only it's not oxycodone, it's fentanyl. You take one pill and you die. That is the scariest thing about today's fentanyl epidemic.
I've been incarcerated for a long time though, so like I haven't really done a whole lot of life stuff in a while.
How long have you been incarcerated?
Well, I did 4 years before this time. I was out 6 days, and then I got arrested for these charges.
Okay.
And now I have another 8-year sentence.
I understand.
I smoked weed for the very first time when I was 13 years old. I remember sneaking out of my grandmother's window and stealing her car and driving to the beach and smoking weed with all my friends. And it just escalated from there. I don't think there's a drug out there that I haven't tried.
So did you ever get into opioids, heroin, fentanyl, pain pills, anything like that?
Yes, in high school, I was snorting your Percocets and your Lortabs, and then it kind of just escalated. Before it was all said and done, I was doing fentanyl.
To understand addiction from a brain standpoint, I talk about stop and go. The go system of our brain is the pleasure center of our brain. It's responsible for our desire and our will to live, and for our species going forward in time. What happens in addiction is this. That desire and will to live is replaced by whatever the drug of choice is. And the kicker is the craving for that drug of choice is 10 times stronger than our craving is for food when we're hungry and water when we're thirsty. Now, what would you do in order to get the thing you think you'll die without? And the answer to that is anything. And when you took the fentanyl, did you know how powerful it was? Did you know it could kill you?
I knew fentanyl could kill me. I did not care. I wanted to numb myself. I believe that addiction is definitely a sickness. It is something that has took control of my whole life for a very long time, to a point where I would do just about anything to get that feeling or that drug. And I didn't know how to deal with it. I've never known how to deal with it my whole life until I've came to this program, and I've learned that it's a disease. I didn't know that before. I just thought, hey, I'm an addict. I like the drugs. But that's not the case. It is a disease, and I believe that with my whole heart.
The go portion of our brain, which is responsible for our will and our desire to live, has that goal replaced by whatever the drug of choice is. And people who are addicted do not have access to the frontal lobe of their brain that gives them insight and judgment. So they're solely driven by their reward system, solely driven by the pleasure system. So to get this thing out here that they think they will die without, they will literally do anything. And when it comes to the consequences of whatever they happen to do, rob somebody, steal, right? Sell drugs to make enough money to buy it on their own, they lack the insight to see the consequences of those choices because they're solely driven by the reward center, because the stop part of their brain has been basically severed. It's been like a frontal lobotomy. It's been separated from the body, and they don't have access to it. So taking a look at that scenario, you've got this thing out here that you think you'll die without, and you'll do anything to get it, and you lack the part of your brain that gives you insight and judgment and helps you understand consequences. And I think when we understand that part about addiction, we can start to make sense of people's behaviors. Hey, tell me a little bit about growing up and what your exposure or use of substances were in your life.
I grew up with a brother and a sister. My mom worked all the time. My dad was an alcoholic and was not there much, so my mom focused all her interests into working and providing for us. My parents were both there, but I had an absence of both parents. So when I was 13 years old, this new girl came to school, and she was like, "You ever smoked weed before?" And I'm like, "Yeah, never smoked weed before, straight A student, 4.0, you know?" And I was like, "Yeah, trying to fit in." So we smoked weed, I hated it. I brought it to school that day, and somebody told on us, and I got arrested. They handcuffed me at 13 years old, escorted me out of the school, and took me to juvenile detention. I didn't even know what addiction was. My mom just said, "Don't do drugs." I'm like, yes ma'am. But I remember just doing a line of drugs. I don't even know what it is to this day, but that's when my pill addiction became a thing.
If I put everybody in a room and I taped the room off and I restricted access to food and water, and we sit there and looked at each other day after day, a couple of things are gonna happen. One, we're gonna drink each other's urine. It's gonna happen. Two, we're gonna eyeball each other to see who gets eaten first, and then we're gonna go up the list. That's how strong your desire and your will to live is, and that is in your pleasure center, your go system.
I worked for a little bit at a few different places, but never anywhere stable because I could never pass a drug test. 21, I got pregnant with my son. I was still on pain pills, the Annexes. I had told the doctor that I was using pain pills, because he just dismisses it. Well, I'm sitting there crying because I know what I'm doing is wrong to this baby, but I can't stop. So I tell the lady I'm getting pills from, I'm like, hey, please don't sell me no more pills because I'm an addict and I'm gonna say yes, even though I don't want to. And she was like, okay. Next day, hey, I got some Percocets. And I'm like, yeah, I'm hurting, I'm withdrawing. Of course I want them.
This separation between the go and stop parts of our brain are not permanent. Whenever drug use stops, the frontal lobe of the brain, the stop part of the brain that gives you insight and judgment, starts to come back online. We know it's going to take 90 days for the frontal lobe of the brain, the stop system, to even begin to come back online, and it's going to take 2 years for it to come fully back online. How in the world do we keep them in the treatment process in order to give their brain a chance to recover? The good news is we do have medications that can help with this. We have medications that quell cravings. What does that mean? We can give somebody a medication that has opioid use disorder. They're addicted to pain pills, they're addicted to heroin, they're addicted to fentanyl. And we can quell their cravings and hold them in the treatment process to give the frontal lobe of their brain time to recover so they can develop insight and judgment, make better decisions. We can start to treat those underlying drivers of addiction, which are physical, sexual, emotional abuse, and any untreated mental health issues such as depression, anxiety, or post-traumatic stress disorder. Now, the problem with medication is the stigma associated with those medications. They don't believe in medication. You're trading one drug for another. The faith-based community, which could be very, very helpful with regards to addiction, looks at it as a crutch. You should be able to go to church more. You should be able to attend 12-step meetings. You should be able to pray about it and get better. And all those things are very important. There's a spiritual component to everything, at least in my mind. But if I have a broken leg, I'm going to see an orthopedic surgeon because I believe that God put orthopedic surgeons in the world to help my broken leg. The third program I'd like to highlight is a program called Hustle Recovery. Programs like Hustle Recovery have started things called respite housing, where we can go ahead and take them that day, get them in stable housing, get them out of abusive situations, maybe get them on medication to quell their cravings, and buy them time until they can get into those treatment programs. These are the kind of things we need to be looking at going forward.
Like what you're talking there. All right.
Thank you.
Cameras rolling. Speed.
Hustle stands for how you survive this life every day, and we believe people can do it through recovery. We are a grassroots 501c3 nonprofit. What we do is we knock down barriers to recovery. People who are in addiction who decide that they need some help, a lot of times they don't know who to call. They call Hustle, and we make the calls for them. We're connected with over 50 different treatment facilities and over 100 different sober living houses.
What are the results of these programs? If somebody comes into the ED, they overdose, they go into a treatment program straight out of the emergency department, do they have higher survival rates at 6 months, 9 months, a year, and 2 years? We need to know the answers to those questions. Talk to Troy a little bit about your substance use, how you got started, and where it took you.
Well, I guess it all started back in high school. I started, drinking and smoking pot. I guess when I was probably about 30 years old, I hurt my back at work, and I got prescribed way too many pain pills.
Before they prescribed those medications, did they ask you any of your own personal history with substances?
When they prescribed that to me, the only thing that they asked me about was things like just my medical history, like past surgeries, any type of allergies, if I had any heart problems, diabetes, or anything like that in my family. I was on pain management for 6 years until I went to the doctor and asked her to take me off of them. When I asked the doctor to take me off of those, he prescribed me Suboxone. Suboxone is a drug used to treat opioid addiction. I'd relayed to the doctor that I had been taking way too many of my prescription, or more than what I was prescribed every day. I told her that they helped me to work longer, they made me more social, and they basically made me feel like I could do anything in the world. Growing up in my house was pretty rough. I was born to a 15-year-old single mother who had a 40-year addiction to methamphetamines. My household was pretty violent. We were raided by the police several times growing up for my mother's drug activities. There was a guy that got his head blown off on my front porch. It wasn't the easiest, but made me who I am today, so.
If we put somebody in respite housing and we keep them there until they can get into treatment, and then they go through the treatment and they come out and they continue in that treatment, what percentage of them are in recovery at 6, 9, 12 months, 2 years, 5 years? These are the things we need to know. It's out there and people need to see you better.
That's one reason why I'm sitting here, Dr. Loyd.
I know.
Because I hate doing stuff like this.
I knew what it was when I asked you to do it. I knew you wouldn't like it. Yeah. And John, what do you do for a living?
I work for Hustle Recovery. I'm the chief operating officer there. Answer phone calls, anything from people that are in our treatment centers, people that are walking around on the streets needing help. I really just want to be the guy that they call and they can trust and you know, rely on. My mother left when I was 12. And I think I saw her one more time since I think I was 18 when I saw her again. But my mom and my dad fought all the time. So it was a lot of trauma there, a lot of arguing, they got physical a couple times, you know, a lot of cops involved. My dad was alcoholic. I started smoking marijuana when I was 13. And then it turned into doing Adderall every once in a while. And then it turned into Loyd tabs, Percocets. One day I picked a needle up, and that's when everything just went crazy. I went from functioning to living on the streets, hotel to hotel, in and out of jail, just completely just messed up everything.
My job as an addiction medicine doctor is to help people find the path to recovery that's right for them. And that path may or may not include medication. My job is to figure that out and what the role of medication is. So John, prior to the needle use, tell me what you were doing. You just taking pills, eating them, snorting them?
Anything, eating them. I was eating pills, snorting pills, a lot of ecstasy, you know, a lot of party drugs. At that time, it was just me and a bunch of friends hanging out. It wasn't like an everyday thing for a long time. It was just on the weekends. It was, I didn't think I had a problem because I was still going to work, you know, I was still paying bills. I was definitely a full-blown addict, you know, without knowing I was, you know. I would miss work because I couldn't get a drug, you know. Pretty much anything you put in front of me during that time, I was gonna do, you know.
The first thing we have to do is we have to keep people alive. We have to keep them alive through harm reduction measures, such as using overdose reversal drugs like Narcan or Opioid. We have to bring them in to treatment programs that meet them where they are, that look at their addiction as what it is, a disease of the brain, to help them with cravings by whatever modality is needed, and to keep them involved in the treatment process long enough for their frontal lobes to recover so they can develop insight and judgment, and we can start to deal with these underlying drivers of physical, sexual, emotional abuse, and untreated mental illness.
Hanging around after last orders, but still so far from home.
As I was sitting on that bed, what I did is I put a post on Facebook on my personal timeline, and it said, in a nutshell, it said, look, man, if you're struggling with this, you don't have to die. There are people out here that will help you. And if you don't know where to find help, here's my phone number, call me. I had no clue what I was going to do to help people. This is kind of where God showed up really strongly in my story, because that post took off. It was shared hundreds of times, and I think at the time I had maybe 80 friends on Facebook. 20 days later, my phone started to ring. And I remember looking at my phone going, oh God, where did I say that at? Because I don't know how to get anybody into rehab. I had no clue how to get someone into rehab. And I sat down with a 3-subject notebook, and when they would answer the phone, I would say, hi, my name is Troy. I'm a recovering addict, and I'm sick of watching these people die. Could you please tell me how to get people into your treatment facility? And I just started taking notes. Fast forward 4 years to today, we work with over 50 different treatment facilities and over 100 different sober living houses, and we've connected almost 4,500 people to treatment.
As the days keep rolling on, we're living in hell again. I still hold you in my arms when these days have been and gone.